Hi guys, we are here at the 4th edition of the Deccan Herald 2040 Summit, and we have a very special guest here with us. We have Karnataka's Health and Family Welfare Minister Shri Dinesh Gundu Rao sir with us. Sir, first of all, welcome to the event. So, you have been an old-timer to Bangalore, you have been a 6-time MLA here, and you know the needs of the city. So, envisioning the future for Bangalore, how do you look at what needs to come in 2040 and what is your vision for the city?
See, Bangalore has got, already we are a leading state in terms of health facilities and health infrastructure. We've got, wonderful research institutions and leading nationally recognized institutions in Bangalore. We have NIMANS, we have a Kidwai Cancer Research, we have Jaideva Heart Hospital in government sector. And of course, private hospitals, there are so many cutting-edge hospitals. And we've got great research facility, Indian Institute of Science, and many of the world-leading companies have got a research base in Bangalore. So I think the way forward for Bangalore by 2040, I think, is to strengthen our whatever that we have in terms of biotechnology, biosciences, life sciences, wellness, everything, along with health infrastructure like hospitals and other facilities. So I think we are planning, and of course with the new Queen City that is being planned outside of Bangalore, where knowledge, health and wellness becomes a part of as a component of the Queen City that we are planning in 5,000 acres. So that also we are wanting to attract the best of medtech companies and companies who are in the pharma sector who are doing research. So all of them, we want them to come there. So way forward, I think, is Bangalore is a leading state in terms of workforce availability, research, scientists availability and facilities. So we need to strengthen that and take it forward. And I think we will become, I think, one of the health capitals of the world. That's the way forward for Bangalore.
Sir, while speaking, you made a very interesting point during the panel discussion here. You were saying that everybody has access to the most famous doctor in the world, that is Google. And while speaking about the advantages of such, easy access to information, you also spoke about the drawbacks of how people without proper knowledge could use it and fall into a pit. So how do you think the younger generation can actually effectively channelize such technologies to their advantage?
See, I think AI, Chat GPT, and all artificial intelligence networks and Google, all that, definitely I think the knowledge availability is fantastic, and for laymen, for them to understand things has become so easy, and it's wonderful. But at the same time, I think we need to have a check on it, because what we read there could be something which may not be applicable to you. It may be in certain ways, but not in all ways. So for that, I think there's no other way than having a discussion with a person who's an expert in that field, either a doctor or a research person or who knows that field well. So that, I think, becomes the key. So people who access this information, I'm not saying you should not, but do not take that as the answer. You should always have a discussion with an expert or the professional, and then take things forward. This self-medicating yourself, self-diagnosis is very dangerous, and it can have very severe, dangerous consequences. So that we should be very careful. So we can't stop people from accessing this information, but we should definitely think twice before following any of those things that comes up that you see across in social media and and on the internet.
So final question. Speaking about the need for both private sector and the government to collaborate on different issues, including technology and the way to go forward, you spoke about the Queen City initiative of the government, which is coming up near Bengaluru. What other initiatives is the Siddaramaiah government planning in the near future in this regard?
See, now in terms of healthcare, we are strengthening our facilities, we are expanding our facilities, we are building more hospitals. We are now also for mental health and these kind of things, we want all our medical college hospitals also to have rehab and de-addiction centers, and we are increasing prevention. Our focus is getting more into preventive healthcare, so that we can try and detect early, diagnose early, or even prevent the onset of diseases. like lifestyle changes and making people aware of the consequences, whether it's physical or mental. So we want to focus more on public health. And of course, curative healthcare is very important. But I think setting up people on the right path at a young age, that I think becomes the key to have a healthy society. So that's the focus that we are working on. Our Griha Arogya scheme, which is going to each and every house, talking to the people and finding out the problems. That is one approach. Second thing, using technology, we are able to directly take advanced healthcare consultations to the rural areas, like the taluka headquarters and the district headquarters, even to the village level. So bridge the gap in terms of availability of super special healthcare from the metros and the top cities to the talukas. So that is another initiative that we are doing.
Right. So, sir, finally, just one suggestion or one point you would like to make regarding this vision for 2040, both from Deccan Herald as well as from a citizen's point of view.
I think healthcare wellness I think is becoming a very important part of life. I think how we lead our life and the way we lead our life, that I think is becoming the biggest issue in healthcare, because health is in our hands, actually speaking. If we follow basic principles of good lifestyle, good food habits, good physical activity, everyone can live to the age of 100.
Right.
And you can live a healthy life. So I think we should realize that it's in our hands, and we should start early. We should not say that I am 18, I am 20, I can do what I want. If you start early, I think everyone can have a very healthy life. So that I think becomes the focus, should be the focus.
Thank you, sir. Thank you, sir. So that was Health Minister of Karnataka, Dinesh Gundu Rao, here with us, sharing his thoughts about Deccan Herald 2040 and his vision for the city in the days to come.